Hi, I'm Danny Erickson, Project Manager and Analyst here at 6 Degrees. If I asked you to guess the percentage of time that doctors wash their hands before and after seeing patients, what would you guess? Obviously, in an ideal world, that number would be 100%. Doctors are well educated and know that the spread of bacteria and germs contributes to preventable diseases and infections. But in 1996, Australian doctors in a pediatric hospital reported that their hand washing rate was 73%. Not perfect, but not awful. However, nurses were observing those doctors during the same period of time and reported that the doctor's hand washing rate was actually about 9%. Similar studies have shown that doctors have the lowest rate of hand washing among all healthcare staff. I was lucky enough to get to see Stephen Dubner, the author of pop economics books such as Freakonomics, speak at the Qualtrics Insight Summit in Salt Lake City last month. He talked about how one hospital in Southern California attempted to change doctor hand washing behavior through the use of monetary incentives and other novel approaches. Their first attempt was sending out a memo to doctors reminding them that washing their hands is essential. This had no effect on doctors' hand washing frequency. Next, the hospital tried giving out $10 Starbucks gift cards whenever the doctors were seen washing their hands. Surprisingly, the $10 gift cards slightly bumped up the doctors' hand washing frequency, even though those doctors had salaries upwards of $200,000. But this method was not sustainable nor effective enough. So, the hospital's leadership team decided to test their own hygiene by placing their hands in petri dishes in order to examine the bacteria that they were carrying around. The bacteria in the dishes grew to reveal what is really living on a pair of unwashed hands, and it wasn't pretty. The hospital's chief of staff decided to take a picture of those petri dishes and set those pictures as the desktop background on all of the hospital's computers. As a result, the doctor's hand washing rate, remarkably, jumped up to nearly 100%. Clearly, monetary incentives are not always the best promoter of a desired action, because human actions are often based on subconscious and complex psychological principles. In this case, a simple visual cue had the most powerful effect. In market research, we always have to work within and around those principles in order to find out what really motivates people to act the way they do.